Hello everyone. I don't know about you, but there are times I dread going to the doctor. According to Cleveland Clinic, 72% of men would rather clean their toilets than go to the doctor. And nearly 77% of men would rather go shopping with their spouses. Now those are some rough numbers. But what makes going to the doctor so painful? In a perfect world, everyone should be excited about going to see their friendly neighborhood physician. Well, as it turns out, most of the disconnect lies in communication. I can recall multiple occasions where I've left a doctor feeling rushed or unheard. A doctor visiting a patient is a personal, nuanced interaction between two people, neither of whom have all the answers. Only through effectively communicating can doctors and patients correct the dots to reach a mutually beneficial conclusion. While it may not have been on everyone's MCAT, health communication is how a doctor brings their knowledge into the real world, and positive patient relationships can serve as the backbone of a physician's practice. Today, we're going to take a look at what makes a good or bad doctor-patient interaction. Having a positive relationship with your patient is an overlooked yet extremely relevant aspect of a physician's practice, as it can make the difference between life and death. Just like any relationship, these interactions are founded on interpersonal skills, trust, and honesty. Today, we have with us 4 of my fellow pre-medical students here at MSSU: Steve Abraham, Nitin Namburi, Luke Fournier, and Emil Dudia. These students have graciously taken time out of their busy schedules to help us visualize what makes and breaks the bonds of trust between patients and doctors. So now I'm going to turn it over to my colleague, Luke Fournier, who's going to talk more about bad doctor-patient interactions.
We've all been to a doctor who we had a less than ideal experience with. Maybe a persistent sinus infection led you to an ENT who seemed rushed or cocky. Or maybe the last time you saw your primary care physician, they seemed uninterested or busy. Well, despite how bad you may have felt about the interaction, your physician was likely trying to be a good listener or trying to make you feel heard. The doctor-patient relationship can be a lot more difficult to nail down than you might think, and doctors often make mistakes while having good intentions. Now I will go over a few ways in which the doctor-patient communication can go wrong. According to Dr. Jennifer Fong Ha and her co-authors in an article from the National Library of Medicine, pitfalls in the patient-doctor relationship come from 2 places: from internal factors such as fears and anxieties from the patients and or physicians, as well as from external factors that occur during the interactions. For example, let's say a patient has to see a physician who is still in training, and this gives them a preconceived notion about the quality of the care that they'll receive, influencing their perception of the visit, while the physician might not be looking forward to the consultation because of sheer exhaustion and burnout. These are internal factors that mentally set up the interaction on both sides. Then, during the consultation, the physician takes thorough notes to make sure that all the details are considered when trying to make a diagnosis, fearing that he will miss something important. These combined circumstances will lead the interaction to be less than desirable for both patient and physician. Of course, there are many other problems which cause poor interactions. Fallon Chapidza and co-authors describe in an article from the National Library of Medicine factors that can lead to poor interactions that come from the patient and the physician. Patients may contribute to poor interactions if they are seeing an unfamiliar physician, receive a poor prognosis, have an emotionally frustrating diagnosis, have a poor attitude towards doctors in general, or have low health literacy. Contributing factors from the physician include patient overload, burnout and emotional exhaustion, lack of experience, poor communication with the treatment team, distraction, and bad posture. Now let's take a look at an example from this poor interaction between an impersonable doctor who is swamped with patients and a concerned patient who is unfamiliar with this doctor.
My name is Nitin Namburi, and I am a pre-professional in the Yours to Lose program here at Missouri Southern State. In this demonstration, I am the doctor.
Hi, I'm Steve Abraham. I'm also a pre-professional in the Yours to Lose Direct Med program in Missouri Southern State University, and in this demonstration, I'll be playing the patient.
It says right here you were admitted here last night for an asthma exacerbation, and you were given a couple of treatments during the night. It also says that you were giving some prednisone, and it seems like you've been doing a lot better.
No.
I think we can make plans to get you discharged by tonight, and if I'm going to be completely honest, I actually have a patient down the hall at room 54 that I need to check up on. This is supposed to be my easy room, but I've been here for way longer than I was expecting. so I'm probably gonna go.
What about me? The treatment I'm on is currently not working, and I'm really concerned for my health.
I'll see about it. You honestly look fine. Like, actually, I'm gonna try to make arrangements to get you discharged by tonight, or actually right now.
Don't you think that's premature? I'm not feeling good.
Excuse me, sir. I'm actually the expert here, and I would appreciate if you treated me like a professional.
Sorry, I'm just concerned about my health, doc.
Okay, I really think I need to move on to my other patient soon. It looks like you're doing a lot better than them, and I really wouldn't be complaining if I were you.
Okay.
I'm just gonna check your heart and your lung really quick. Yeah, you look fine. All right.
Okay. Well, I was Steve Abraham. Nice to meet you, doc.
Thanks, guys. Now I'm going to turn it over to Amal, who's going to talk about what good doctor-patient interactions look like.
Now that you know what ineffective doctor-patient communication looks like, I'm going to explain how it can be improved and give a demonstration. Honest communication between doctors and their patients is very crucial, as it is indirectly part of the patient's healing process. According to an article from the Duke Center for Personalized Healthcare published in March of 2019, effective communication has increased patient satisfaction and patient knowledge of their diagnoses and treatment options. According to the Doctor-Patient Review published in 2010 by Dr. Fong Ha and Dr. Nancy Longnecker in the Oshner Journal in the National Library of Medicine, to have good doctor-patient communication, one of the key components is doctors giving their full attention to their patients and developing excellent interpersonal relationships and effective bedside manners, which patients value as their doctor's competence in treating their health conditions. This will help the patient stay focused as doctors provide vital information that could be useful during the treatment process. This also provides patients with emotional support and helps the doctor understand patients' verbal and nonverbal communication. Another component of doctor-patient communication is allowing the patients to ask any questions so that they have a better understanding of the health diagnosis. By doing this, it helps clarify any unclear information such as medical terminology or following treatment protocols. According to the NIH, National Library of Medicine, National Center for Biotechnology Information, patient-initiated questioning is encouraged when an explanation and display of test results is present. For example, if a patient was diagnosed with gastroesophageal reflux disease or GERD based on the test results and the doctor gave an explanation about it and the treatment options, the patient will better understand them and can make a rational decision on the next steps. Now let's see an example of how this patient-doctor communication is improved.
Good afternoon.
Good afternoon, doc.
My name is Dr. Nyamburi.
Nice to meet
I'll be helping you and working with you today.
you.
Is it okay if I ask you a couple questions and write a couple things down? Great. I'm just going to verify your first and last name. If you can tell me your first name, please.
Steve
Steve. And your last name?
Abraham.
Abraham. Great. Okay, and your birthday?
April 20th, 1943.
All right, Mr. Abraham. It says right here you were admitted last night with severe asthma. With your last visit, we actually got you a couple new prescriptions. How have those worked for you?
Those haven't been working at all. I have trouble breathing at night, and it feels like a weight is on me every time I'm breathing when I'm awake.
Really? I'm sorry to hear that. Well, I'm going to try to figure something out and get something that works for you. It also looks like the nurse said you had some prednisone last night, and so if everything goes as planned, you should be discharged by later tonight. Do you have any questions for me so far?
Yeah, because the current medications aren't working, what would be the next step?
Yeah, so I actually arranged a new set of prescriptions for you, and they'll be ready for you and scheduled for you around an hour from now. If you have any questions or if you experience any problems in the meantime, feel free to call me up and I will assess the situation and help you out in any way I can. Do you mind if I listen to your lungs really quick?
Yeah, go for it.
Great. Can you breathe in for me? And breathe out. Great, thank you. I'll get back with you, okay? Thank you. Have a great day.
Yeah, you too.
So now we're going to put all this knowledge that you've learned to the test with a short little quiz.
What did Dr. Namburi get right in his second interaction with Steve? The correct answer is listen carefully. According to the American College of Obstetricians and Gynecologists, doctors that are willing to patiently and respectfully listen to their patients are able to establish clear communication with their patients in order to better assist them. According to CHPIDSA, which of the following is not a patient-contributed factor to poor doctor-patient interaction? The correct answer is patient overload. If you thought the answer was low health literacy, according to the National Library of Medicine, Dr. Kathleen states that patients who are unable to successfully interpret health information have increased hospitalization rates and make it harder for the doctor to help them. Therefore, this answer is incorrect. Seeing an unfamiliar physician is also an incorrect answer because, according to the Journal of Health and Social Behavior, Dr. Hall states that the new doctors that do not properly greet their patients can potentially lead to the trust or communication issues that will result in the detriment of the patient. True or false? It does not matter whether or not a patient understands you, as long as you use the right medical terminology. The correct answer is false. What is something Dr. Namburi did wrong in his first interaction with Steve? The correct answer is no eye contact. According to a study published in the National Library of Medicine, Dr. Khan states that eye contact is an essential nonverbal tool to make a patient feel heard. According to CHPIDSA, which is not a doctor cost factor leading to a poor doctor-patient interaction? The correct answer is lack of knowledge. According to a study published in the National Library of Medicine, Dr. Gaskell states that doctors do not always know the answer to everything. While they may not be suited to assist you in that moment, not knowing what to do does not mean that there is a poor patient-doctor interaction as long as the doctor clearly conveys their lack of understanding.
In conclusion, doctors and patients have a relationship that's built on personal connection, trust, and honesty. When doctors know their patients and are willing to listen and even learn from them, they have a more constructive and mutually beneficial interaction. So hopefully after watching this video, you are one step closer to getting your patients to skip shopping and head to the doctor. I'm Turner Fehrenbach, and see you next time.